Hi guys, my name is Ishani Vengala and I am the director of the media team with Dream Journal. So today I'm here at Liberty Hospital. I'm going to be interviewing Dr. Amy Patel, who is a breast radiologist here, but I will be kicking off our new series where we interview medical professionals and people involved in the field for current medical students to get an idea of what it's like to get through medical school and be a physician. Today I'm here at Liberty Hospital and I'm with Dr. Amy Patel. Hi, Dr. Patel.
Hello.
So I'm going to ask you a couple of questions about you and your experience and what's brought you here today.
Okay.
So first off, what do you do here at Liberty Hospital?
I'm a board-certified breast radiologist, so I'm the one who detects the breast cancers on breast imaging, mammography, ultrasound, MRI, do biopsies to diagnose breast cancer, work with the breast surgeons to take cancers out. So that's my clinical role. I'm the medical director of the Breast Care Center here at Liberty. I chair all the cancer programs as well at Liberty, so I have a lot of clinical and administrative responsibilities. Not exactly. I've come from a small town in northwest Missouri, and I thought I'd go home and do primary care with an emphasis on women's health. So I've always loved women's health. But then in my fifth year of medical school, I did the UMKC 6-year med program. I did an elective in breast radiology, and I sort of fell in love with it. It had everything I wanted in a career, patient interaction, women's health, detecting breast cancer, feeling like you're really making a difference. So I shifted gears after that rotation, and that was it, and kind of never looked back. Yeah, so I'm kind of different in that I already knew I wanted to be a breast radiologist in med school. So then I knew to get there, I had to do, my intern year. I did an internal medicine at UMKC, and then I did 4 years of diagnostic radiology residency at the University of Kansas, and then I ended up doing a 1-year breast imaging fellowship at Washington University in St. Louis. So to be a breast radiologist, to be fellowship trained, you have to get through all of the radiology residency first before doing the 1 year of fellowship. So breast imaging or breast radiology, we basically read mammograms, different kinds of mammograms, breast ultrasounds, breast MRI. We do all breast image guided biopsies, so under mammography guidance, ultrasound guidance, MRI guidance. We localize breast cancers at the time of surgery, so the surgeon knows where to take the breast cancers out. We see patients for all sorts of breast cancer, breast disease, patients with implants, patients on hormone replacement therapy who might have breast changes. So we're highly subspecialized, and there's a lot that is encompassed in the field. Yeah, I mean, I think it just depends on what your interests are, essentially. I think that, you've got to find kind of what is your passion and what makes you tick. For me, again, that's women's health and closing the gap to breast care disparities in a part of the country that really needs help. I used to practice on the East Coast, and I ended up coming back to sort of serve the area because I felt it was important that I kind of gave back to where I was raised. And if I have this expertise, I want to try to impart that for the patients in the area in which I was raised, people who raised me. So you really have to do some soul searching because medicine can be exhausting. You have some really exhausting days. Burnout in medicine, unfortunately, is very real. So you want to ensure that you find a profession that's going to fulfill you for the rest of your life. Yeah, I think the hardest part was just specifically the first couple of years where you have so many hours and I was taking 22 hours a semester and trying to juggle that and study and go to class because where I went to high school, most of my college credits did not transfer over to UMKC. So just sort of playing the catch-up game and learning sort of that work-life integration or the time management aspect for me was a bit challenging in the beginning, but once I sort of got past those first 2 years, it was a lot more manageable. So, I say to students, I also teach a class at the School of Medicine called Fundamentals 3 and 4. Like, I've been there, done that. Any feeling you felt, I have felt too. But I'm living proof that you can come out on the other side. It's just there will be bumps along the way, but so many of us ended up graduating, so the same will happen for you. I think, for me, UMKC has a really good culture, and that really was wonderful, and a culture of support. I always felt like I could go to somebody if I was struggling, whether it was a faculty advisor, whether it was my docent doctor, whether it was just my peers. And since each class was so small, we all became really close, and I'm still friends with a lot of those students or my peers. Which I really love, because now a lot of us practice in Kansas City and we're colleagues, and we can bounce cases off each other and talk about different patients. And so that camaraderie is really cool. And I don't know if a lot of students from other schools get that, because we are structured the way we are at UMKC.
So we've talked a little bit about your responsibilities outside of the hospital. You're an assistant professor of radiology at UMKC. You're president at the American Association for Women in Radiology. You're chair of the grassroots advocacy at the American College of Radiology, and you're actively involved with the Missouri State Medical Association. So how do you balance all these responsibilities with a busy career as a physician?
Yeah, I have to be very efficient with my time. And then I'm going to throw on top of this a child. I'm going to have a baby in next month. So, that in and of itself is going to sort of, throw things in a tailspin, so to speak. But I think that for me, time management and efficiency is really, really important. I am a big list maker. I'm a big cross off the list. If I'm sitting down for 30 minutes to knock this out, I don't want any interruptions, and I can get it knocked out pretty quickly. And I attribute a lot of that time management and efficiency from the skills I developed as a medical student at UMKC, honestly. Because that really, those formative years, I really had to learn how to manage my time to be able to absorb information, to make sure I'm passing exams and things like that. So I took those lessons, and luckily, it really helps now with my busy schedule.
Yeah, that's amazing.
Yeah.
So what made you interested in being involved in all these different organizations?
Yeah, I've always, I love the clinical aspect, but I always wanted to lead, and I love the administrative aspect too. And I know it's a thankless job, and a lot of people don't like it. It isn't their cup of tea. But, I felt like, I enjoyed leadership. I felt like I was good at it. I felt like, that not, sometimes women in medicine don't take the leap to assume a position of leadership. And I felt like I was in a position specifically here at Liberty and with UMKC where I could really try to implement my skills for good, and be, hopefully a catalyst for change. So, at times I'm a little outspoken. People know this, maybe a bit known as a disruptor, but like John Lewis, who is a representative for many years in the U.S. Congress, he always talked about good trouble. I hope that the people see me as that, because, at the end of the day, I just want to make a positive impact, and I want to make sure that anything I do, I impart a positive impact, whether it's my patients, medical students, residents, my colleagues. That's sort of my goal. Yeah, there's a lot of ways for advocacy. Now I would say at the School of Medicine, they are really placing an emphasis on advocacy. I think just the fact that now with certain committees at the School of Medicine, there's a medical student representative. We didn't have that when I was a med student, and I wasn't a med student too long ago. So that's great that we're already having that happening where students can have a voice. There's other ways, to get involved as well locally, like through the American Cancer Society, the Missouri State Medical Association. Medical students have their own chapter where they can get involved in advocating for patients. Through the American College of Radiology and other medical subspecialty groups, pretty much every medical subspecialty group has an advocacy arm. And then from that, there's medical student basically committees in which they can get involved to advocate for change, so whether it's anesthesia or surgery or OB or what have you. So there's a lot of opportunities now for students that previously didn't exist. So now is a great time to be a student if you want to get involved in advocacy endeavors. Yeah, I mean, there obviously are perils of social media, but I really try to use social media for positive change, and I think that, I've always used social media as a platform to show others what I'm doing, to try to make a positive impact in the field. I don't try to get in any sort of you know, like, negative conversations with people, or I don't try to promote any discourse. Like I say, on social media, I try to stay Switzerland. I don't feed into the trolls. I literally just focus on my mission in terms of letting people know what I'm doing, educating patients, educating providers, depending on what platform I'm on, connecting with local leaders, like if I'm on LinkedIn. So there's always a strategy behind it. But at the end of the day, I want to ensure that any messaging that I'm imparting out there is positive.
Amazing. Do you think more medical professionals should utilize social media?
I do. I think that there's still, a lot of anxiety behind it, and especially with all the negative, the negative things that you can see with social media in terms of trolls and false information and things like that. But I do think that, specifically, uh, social media and healthcare social media is definitely here to stay. Whether you see a hospital system promoting their brand and their services, which is a very cost-effective way to do that, or if it's a physician or provider that is marketing their services or just want to educate their patients, it can be very powerful and it can be far-reaching. So I might have a rural patient that can't come here immediately, but they may see, everybody pretty much has an iPhone or a smartphone these days, and they may see that I post on Facebook, something about breast density, or a coverage for insurance coverage for something of a breast exam that they previously didn't know about, or something. So it can be very far-reaching and positive, and hopefully, when it comes to me and this social media messaging I impart to patients, my hope is that it does end up saving lives.
It's amazing.
Yeah, so I mean, it's hard, it's challenging. I have a paper coming out soon in the Journal of the American College of Radiology about the art of time management. I by no means am, saying in this manuscript that I'm a guru at it, but I just am basically giving tips. Me and a colleague of mine who's a neuroradiologist at MD Anderson, we're both kind of giving these tips of how do we juggle crazy lives and careers, because she's got her husband is an interventional radiologist. They have 2 children. My husband's an architect. He owns his own architecture firm, so he actually works crazier hours than I do. So we just make sure that we have certain times of the day where it's protected. Like, for example, we make sure we eat dinner with each other every night, and we make sure that when we're at the dinner table, we're sharing our day, we're talking to each other. We go to bed at the same time as well, so that's important too. We make sure that we have sort of protected time to have date night and things like that. So, if somebody wants to have a meeting with me and I have in my calendar that I'm supposed to have dinner with Joe, my husband, I'm like, sorry, we're going to have to come up with another day. So I really try not to infringe on the time. And specifically, once we have this child, we're going to make sure that we have that time sort of siphoned out, so that, when it's time to focus on her, we're really, really focused on her. Yeah, I think that it is definitely a challenge. I think that over time you just have to sort of refine sort of your approach to work-life balance, and for some it'll come earlier, for some it'll come later. I'm still sort of learning how to achieve the balance. I by no means am saying that I've won, and I'm and I understand work-life integration. I think I'm getting there. I'm definitely offloading on some things that previously I would just take on, or saying no to things. I think you get to a point where it's okay to say no to doing things. When you're younger, it's like, I want to do it all, and then as you get older in your career, you're like, okay, these are the things that I care about the most, and you prioritize. So it's definitely a learning process. So I would tell students not to get discouraged, and that over time it will get better. Yeah, I think, I wish I would have known that, like you hear that going through med school and residency is like going to be hard, but you don't like realize how hard and like how much of a sacrifice it is until you're actually in it. So I always tell people who are thinking about applying to the 6-year program, I'm like, you need to be really sure that you are laser focused to be a physician, because it's pretty expensive, it's very time consuming. So if you're not quite sure, go ahead and do a 4-year undergrad. Go have some fun. Go, just live it up. See, if you want to be a physician, and then if you do, then you can go the route and take the MCAT and apply for medical school. But you really have to be committed from the get-go, especially for any sort of accelerated program, whether it's a 6-year program, a 7-year program. And I think I just had a bit of a shock, particularly my first semester. Like my first, I took we're in anatomy class, and I got like a C+ or something. And I was like, oh my gosh, I've never gotten such a bad grade. So it's sort of like a wake up call. So although I say I wish I would have known like how tough the road would be, I think you never really know how tough it is until you sort of start on the road. And some students do better than others depending on where they came from. If they came from some private school where they had like really incredible education, or even a public small school that had great education, everybody came in with different backgrounds. For me, it was definitely there were some strengths in some areas and weaknesses in others, but that was probably the one thing I kind of wished I would have been a little bit more prepared for, the drastic change and sacrifice that I essentially encountered with the rest of my years of training. Yeah, I would just say that even though it can be really stressful and challenging, try to enjoy it. These are like the best years of your life, whether you believe it or not. It's protected time. You have a fallback, when it comes to like if you see a patient and you're not sure what to do, you have a resident to help you, you have faculty member to help you. Once you're out on your own, it's a little bit more nerve-wracking because you're the one that's sort of making the call. So just enjoy these years, form those relationships and friendships with your cohorts, and keep up with those connections. I had a baby shower Saturday, and one of my best friends from medical school, I haven't seen her in like 4 years. She drove from Omaha to come to my shower, and it was just so wonderful to sort of reconnect, and because we had been so close. So I think that just making sure that you maintain those relationships and sort of take a breath and sort of enjoy what's happening around you is really important.
Well, that's all I have for you. Thank
Great.
you so much, Dr. Patel.
Yeah.